Hi, everybody. I'm David Brown. I'm Divisional Dean of the Social Sciences, and I wanted to welcome you to another webinar on race and inequality. This one happens to be on race, inequality, and COVID. A lot of things that we're finding out about this pandemic is that it affects a lot of people very differently. And so we're extremely happy to have some interesting panelists here to cover a number of contexts or different things that you may not have thought about in terms of how COVID would actually affect different populations differently. And so let me first just introduce who we have on the panel, and then I'm going to invite each panelist and go into a little bit more detail about their background before they give a very short presentation. And then after that, we're going to open it up to questions from the audience. So we have the chair of ethnic studies, Arturo Aldama. We have an associate chair from sociology, Rinaldo, and we have the chair of speech, language, and hearing sciences, Jack Damico. Each one of them has a very unique perspective on the question for today. So I'm not going to say any more other than keep looking in the weeks to come. We hopefully will have another webinar in January. But having said that, let me further introduce Professor Aldama. Professor Aldama works on a number of things that are related to the subject at hand today. He looks at Chicanx culture, film, those sorts of things, and also Mexican border relations. One of the things that he's been working on lately is masculinity. He's got a book that's coming out, if it's not already out, on masculinity. You can talk a little bit about that, Arturo, but he's coming from a perspective where he'll be able to talk about race and inequality and COVID, and also how it is affected by masculinity and white fragility. So having said that, let me turn it over to you, Arturo, for your short presentation.
Wonderful. Thank you so much, David, for organizing this. And thanks to you, both Rachel and Jack as colleagues in our Division of Social Sciences. Yeah, right. My book on decolonizing Latinx masculinity just came out a little less than a month ago, or a month and change. So issues around masculinities are kind of on my mind. And that's kind of what is inspired my brief kind of presentation on basically toxic and racist masculinity and its impacts on BIPOC communities vis-a-vis COVID. So I'm going to go ahead and do a screen share on a very brief PowerPoint and some comments. And I look forward to some great discussion questions and so on and so forth. So give me a minute to, hopefully it'll work on Zoom. It's always, there we go. Cool. So I'll do a share here. Can you all see it? Where it says racist masculinity? Yes. Yeah. Okay. So really the kind of provocative question is really racist toxic masculinity, manslaughter, depraved indifference, or first degree homicide via COVID towards BIPOC communities. So as right now, today, we're all waiting for the Trump appointee GSA person, Emily Murphy, to ascertain President-elect Biden and Vice President Kamala Harris to be able to begin working on the peaceful transfer of power, and in particular, get on point with what is being done and what needs to be done regarding providing some serious leadership on COVID. So it's really easy to argue that Trump's continued flagrancy of taking the CDC guidelines and an unwillingness to provide any serious leadership around the COVID-19 response will arguably cost more and more lives. It seems that Trump, his inner circles, and the sycophants, both elected and non-elected, have really bought into how Trump and his performance of a certain type of hypermasculinity and a toxic masculinity, which arguably is actually literally toxic in terms of the super spreader events that Trump has enacted for a whole variety of contexts, and his constant disavowal of science-based safety measures, and then mapping that into some type of struggle for liberation and freedom among his followers, which freedom and liberation from what? So as we know, or hope we know, BIPOC communities have been hit hardest by the infection. the mortality, our BIPOC communities have the highest mortality rates, and Trump's constant cementing of COVID-19 to China has caused a specter of anti-Asian xenophobia that has been part of the US body politic since the 1850 gold rush, and the literal demonization of Chinese miners and the resultant upsurges of racist xenophobic violence. Tribal nations like the Navajo Nation have been hit extremely hard, as well as the frontline workers, which in the Latinx community that I'm part of, I'm the light skin of the family. My grandma is basically full-blooded indigenous. My other family members are kind of Afro, look more African Mexican. I came out looking white, I don't know why, but so in our community, for us, many of the frontline workers are the folks that pick the food that we eat, the folks that work in meat packing, the folks that serve the food and do a lot of close quarter kinds of service work. And for many working class communities in general, working class BIPOC communities don't have the quote unquote luxury of working from home, right? In the context of African Americans, the ratio in infection and death are stark, and the events, the longstanding practices of institutionalized racism, specifically anti-Black racism, which typically has been looked at criminal justice, but now a serious look needs to be considered on, the health industry and its kind of literal mortal impacts on African American communities. So I'm going to pull up the CDC numbers. Although, part of what we're seeing with Trump's constant firing of people that, he disagrees with or that try to present an actual factual based narrative, it's hard to see if these, numbers are actually legit. I think traditionally we trust the CDC data sets. I don't know what kind of pressure the CDC scientists are under. If presenting data sets that might basically anger Trump and his followers, and or what kind of political pressures they might face. And so, but regardless of all of that, again, my skepticism around this, and I'll be curious to see other folks who work in kind of health related social sciences, how they're thinking about CDC data sets now in this context, right? It's still pretty, horrifically disturbing. American Indian, indigenous folks, 2.8 higher cases. I mean, the numbers kind of speak for themselves. African American or Black folks, 2.6, Latinx, 2.8, and so on and so forth. The New York Times, they actually had to sue through Freedom of Information, the CDC, and they actually did a much more granular look at BIPOC deaths. They actually looked at county by county. They looked at over, was it 294 or 974 counties, if I remember correctly. They also flagged that the CDC, in many cases, isn't really paying attention to race and ethnicity in how they're reporting both infection and mortality rates. So the numbers they came up, which are really pretty horrifying and disturbing, is, coronavirus cases per 10,000 people, white, non-Hispanic, 23, African American or Black, 62, and Latino, 73. And so these are the kind of numbers that, are pretty horrifying. So to kind of end these brief comments, because again, the whole point is to, engage in discussion, is, since Trump got infected by the COVID and some of his inner circle, he's been on this kind of mission of bravado, and somehow his masculine bravado, his machismo in a sense, is somehow stronger than COVID, right? And so some of his elected sycophants are, Representative Senator Matt Gaetz. He's really a belligerent supporter, bellicose supporter of Trump. He quoted, President Trump won't have to recover from COVID. COVID will have to recover from President Trump. And then I'm going to end by just showing the 2-second little video clip from Kelly Loeffler, who's locked into a Senate runoff in the state of Georgia, and her tweeted, video that she did of Trump, in a WWE kind of wrestling beating, COVID, has like 8.2 million views and things like that. And then I'll, finally, so I'll end with showing that video because it's pretty ridiculous. But I guess Trump supporters like it. I'm just going to end by just a couple comments about Florida and Latino men, cisgender men in particular. So some comments were made earlier where everyone's trying to predict the election and the Electoral College is that, you know, whoever wins Florida is going to have a real shot in terms of actually winning the presidency. So when Trump won Florida by a, you know, fairly decent margin, it became really clear the main reason that Trump won Florida was the Latino vote, in particular Latino men. And so there's been this whole other kind of discourse going on that how Latino men are really connect and identify and respect Trump's kind of, you know, being a true man, a real macho, a real leader that's stronger than COVID and all of this kind of stuff. So my comments about that is that, as we know, Trump's campaign, from his original campaign to running for the nomination for president and then his reelection campaign and kind of throughout his, you know, ongoing public rallies, he's developed this way of kind of rallying his arguably white supremacist base by demonizing and criminalizing in particular Latinx people, but in particular Latinx men as the quote unquote bad hombres and rapists and filth and drug dealers. Like, yay, Trump, I feel so supported, right? But yet I end with who's the real bad hombre, right? How many thousands of lives have been lost by this quote unquote bad man? So I'm gonna go ahead and put that Twitter thing here so you can just see it for yourself if you haven't seen it. It's pretty ridiculous, but so give me a minute. Hopefully it's gonna work. Dun, dun, dun. Where is the Twitter thing? Where? Oh, there it is. Cool. Y'all seen it? COVID, yeah. No chance against Donald Trump. Okay, so I'll go ahead and play it. Anyway, you get the idea. So, so yeah. You know, that's my prefatory comments. Thank you so much.
Okay. Thank you, Arturo. Next, we're going to go on to Professor Rachel Rinaldo. Let me tell you a little bit about Professor Rinaldo. She focuses on gender globalization, culture, and religion. She's done a lot of work in Indonesia, looking at religion, gender, and Islam. Just recently, she's traveled to an even more exotic place, and that's the Denver metro area, to do some studies on gender and how folks are dealing with the pandemic. And so please welcome Rachel Rinaldo.
Well, thanks very much, David. And especially thanks for organizing this panel, and thanks to Arturo and Jack as well. I'm really fascinated to hear more about their research. So just to share my screen here, let's see. Let's see, sorry about that. Just get it up here. Oops. All right. So, all right, can everybody see that? Great. Yes. All right, so I'm first just going to talk a little bit for the moment about the gender inequalities, broadly speaking, that we're seeing during the pandemic. And then I'll turn to a little later talk about the research that I've done in the Denver Boulder area, along with my student Ian Whalen. So a lot of you probably saw this headline in the New York Times yesterday, highlighting the impact of the pandemic on women, and particularly women's jobs, and how it is pushing women out of the workforce, both because women have been disproportionately affected by layoffs and furloughs, particularly women of color. But also because women have, in many cases, had to step down from jobs or reduce hours. So the numbers are quite significant, and certainly I think a lot of folks suspect that there will be some very long-term repercussions. Just to highlight some of the big studies that have come out recently showing the various patterns. I think one of the more shocking numbers is that just between August and September, 865,000 women dropped out of the labor force. That's compared to 216,000 men. And of those women, 37% are Latina, 7% Black, 56% white. So very widespread phenomenon. We see also a number of recent studies showing that even those women who have not stepped away from jobs or been laid off have reduced their working hours much more so than men. For us as academics too, some recent research over the summer is showing that women scientists and academics are reporting far less time for research and publication compared to male peers. Journals are reporting far fewer submissions from women. And McKinsey, the consulting company, put out quite an interesting report showing some of their own research on these dynamics. And so if you look at the dual career couples and household responsibilities on the right with people with kids under 10, you can see a pretty stark difference in the additional amount of household responsibilities that women are taking on during the pandemic. So that's sort of the broad picture of what's happening. And I think I'll stop there for now and talk a little bit later about the research that I've done here and how some of the pre-existing gender inequalities that we've seen are contributing to the situation.
Thanks, Rachel. That's great. So now we go to our final panelist, Jack Damico. He's the chair of speech, language, and hearing sciences. He's a clinical linguist and a speech language pathologist. He brings sort of an interesting perspective in the sense that he's done an awful lot of work in the public schools. And so he's studied what is called sort of a hidden curriculum that exists in public schools and how people of color have to navigate that. And so I thought that given that expertise and given all the difficulties and challenges that our public schools face now with the pandemic, it would be really great to hear the things that Jack has observed in the past and what he sees happening right now. So having said that, Jack, welcome.
Thank you, David, and I'm delighted to be with Arturo and Rachel today on this, and welcome everyone else for coming over your lunch and dealing with this. I've been involved in work regarding public education and diversity, especially focusing on classroom procedures, face-to-face interactions, and studying the expectations of teachers and children in the classroom since the 1980s, actually. This strand of research is one that I've been oriented to, and I focused on children from diverse backgrounds due to linguistic, cultural, racial, or socioeconomic differences. And I've looked at how they negotiate the school context and how they're able to overcome their differences and the teacher reactions to those differences and succeed, or whether they're having difficulties and they fail. I've conducted a number of extensive studies employing various qualitative research methodologies, 2 elementary schools in the South, another elementary school in the Southwest, and numerous discourse studies looking at various kinds of teaching and learning encounters. Basically, what we're finding is these studies investigated how non-mainstream students, generally BIPOC students, how they negotiate mainstream schools and the results of these circumstances, and how it can help overcome barriers created for these students. That's the really important part. I'll just put up a couple of quick PowerPoint slides myself, just to give you a little idea of this. Relevant findings from 8 studies in the public schools is, number one, many aspects of how to do school go beyond acquiring academic context. We often talk about what students need to do in terms of learning, but really a lot of what goes on in the schoolroom is implicit, and it's something that is due to the expectations and what students bring to the schools. The problem is a number of children in BIPOC communities aren't oriented to the mainstream, which the schools are, and so they don't always they're not always well prepared. There is in fact then a hidden curriculum of skills and strategies. This is implicit, and because most schools are oriented to the middle class and to the mainstream, many of these implicit skills and strategies have middle class values that these kids don't often see or aren't able to see. Children from middle class learn these skills in the hidden curriculum, the strategies and skills in the home generally, but non-middle class kids, lots of BIPOC kids who are not middle class or are not in the mainstream necessarily, usually don't learn these skills and strategies. At schools, these unstated mainstream values regarding how school should be done are often not mentioned or taught, but they are employed when we evaluate children. So when students from diverse backgrounds don't have the skills and strategies, the hidden curriculum, they perform at lower levels sometimes and are often considered remedial students or even students who are in special education. These differences between the middle class and the non-middle class are generally due to socialization differences in the home, due to cultural differences and contextual differences, and nothing to do with proficiency. The result then is that there's often inequality in the classroom and in most learning interactions if children from BIPOC communities, diverse backgrounds, don't use the mainstream skills and strategies. And there have been a number of researchers that have claimed that this mainstream focus results in these children being socialized to essentially stay in their place. We've done a lot of work on what some of these skills and strategies are. I'll just mention a couple and then I'll be finished. The extension of academic talk and the kinds of vocabulary that kids use is often in the hidden curriculum, and children from BIPOC communities fall short on these sometimes. Understanding teachers' expectations in the class scripts, the ability to engage in self-control in early grades, and then self-regulation in later grades, the development of independence rather than interdependence, and the ability to focus on decontextualized activities and ideas like higher reasoning skills, are things that are in the hidden curriculum that these children from the backgrounds, BIPOC backgrounds, don't always get. Now, the hidden curriculum can be modified, and that's some of the things that we've been looking at. A lot of our research in these ACE studies have been geared towards this. And so I'll stop right there, just giving you a flavor of what I'm doing.
Thanks, Jack. Thank you to all for the presentations. Now here, I'm gonna switch up the plans here just a little bit. I'm gonna ask follow-up questions for each of the panelists. And then notice at the bottom of this webinar, for those of you who are watching, there is a Q&A button where we'd really like this to be a conversation in terms of the things that you're interested in. Clearly we have some scholars here that have very vast and diverse backgrounds in terms of addressing these issues. So please, there's no question that that wouldn't be welcome. My guess is that any question you have will be shared by 20 or 30 of the other folks who are watching this. So please take advantage of that. So let me follow up. I'll just do a short follow through with Arturo, Rachel, and Jack. Arturo, with your presentation, what I wondered if you could talk a little bit about was that you gave a great presentation of the disparities that we're seeing in terms of the population and how they're being affected by the pandemic, and it's really accentuated this particular problem. I wonder if the pandemic reveals which aspects of systemic racism seem to be the most prevalent to you, or is it just elevates everything up that much, or is there something that you've identified or you look at and say, aha, because of what we're seeing here, this is a problem that might give us some purchase on addressing this particular problem?
No. Well, that's a wonderful question. I appreciate that, David. One thing I forgot to mention as a roundabout way to answer the question is that a large percentage of the folks that are being hospitalized, in some cases not able to survive COVID, BIPOC folks are actually folks that have disabilities, right? And I hope as we as scholars and, the response, I guess the critical response to COVID is that we develop, perhaps an even deeper intersectional lens to not only think about how it's affecting folks by race and by gender, thank you, Rachel, but also disabilities, right? And so I think you're absolutely right. I think what the COVID pandemic has done or is doing, for better or worse, is that it's really bringing into kind of a bas relief the kind of, generations and generations of deep-seated structural racism that manifests itself in a whole variety of different ways. There's been a lot of really great work on, mass incarceration, the criminal justice system, and its just phenomenally destructive impacts on communities. There's been really good work on health. There's been really good work on schools and the school to prison pipeline. And so I think, what we're seeing now is that it's just really, the mask in a sense has been kind of taken off and showing, the kind of consequences of just generations and generations of folks not having adequate access to healthcare. Another big issue that fortunately was thrown out at the Supreme Court report, and what I gathered from, Justice Roberts, he's kind of annoyed that it keeps being brought up to the Supreme Court, is, trying to toss out the Affordable Care Act or Obamacare. And, because of just, the pre-existing conditions and, all of this stuff. And so it's just really interesting that we're in the middle of this pandemic where people are dying, and, in particular working class people, BIPOC folks. And then there's been this push to try to make healthcare access even more elitist or limited, right? And so, I hope that, or I think all of us can hope that perhaps this pandemic will really push the seriousness of making, access to healthcare, not just if you have the money or not, but a right in a sense, so that, because, what a lot of the kind of responses have been, and I can share a bunch of articles if you want some, even the Lancet, which normally doesn't weigh in, into the political fray of stuff, have come out pretty strongly about condemning kind of institutional racism in healthcare and challenging how we read the morbidity rates in BIPOC communities, because the kind of default response is like, oh, well, Latinos, we all have diabetes. So, that's why we're dying more, right? Which is, a very superficial way of kind of thinking about these things. And so, so we'll see, we'll see if, it's just horrible. It's kind of like the killing of George Floyd. Is it take the deaths, the biopower deaths for things to actually change? And that's a horrible way to think about, is that what is social change based on the little deaths of BIPOC communities in the United States?
Thank you for that, Arturo. That's a great question. Let me now do a follow-up with Rachel. One of the things that I'm glad you mentioned the New York Times article. It was pretty interesting in terms of, they talked about sort of the triple whammy that women are facing because of the pandemic and what was actually going on before it. So what I'm wondering is, do you see any of the, one of the things that the article talks about is how women are sort of the fallback solution for this particular problem, even though there'd been gains, perhaps to have husbands cooking dinner a little bit more, that sort of thing. But now with this, that's sort of been the fallback. And I'm wondering, given that, sort of the severity of the change and what people are struggling with, are you worried that this is going to sort of, I don't know if setback is the right phrase, or alternate or change the progress in a certain direction? What are the long-term conclusions? I guess that's a short way of asking. What are the long-term conclusions here?
Yeah, sure. So I think the long-term implications are very concerning, right? Because we know, for example, that when women especially take a break from work, it makes it much more difficult to get back into work, especially at the level they were at. And this has long-term consequences down the road, right? For their earnings, for their ability to have promotions and so on. Given that women's longevity is usually longer than men's, right? That means that, you know, this could have consequences that sort of are magnified through the course of their life, right? With significantly lower earnings. And, you know, the US has made a fair bit of progress on getting women into the workforce. It's been slower, I think, than originally expected, right? And so we were sort of at a point where just in the last few years, you know, it was starting to look like some of these, you know, some of the issues with women in the workforce were sort of being addressed and gains were being made. And now that's really being rolled back, and we could see, you know, the percentage of women in the workforce potentially, you know, possibly going back decades, right, in terms of that percentage of women that are involved in the workforce. And I do think this has a lot to do with some of the inequalities that haven't been fully addressed, right? That have started to become more part of the conversation in recent years, but really haven't been fully addressed. And if I could just show a couple of slides that relate to this. As you mentioned, women tend to be the fallback caregivers, right, whenever families are in a difficult situation. And partly this is because of something that I found in my study that was a very common pattern. When families are in a difficult situation, like now, when families are, you know, there's no child care, and so somebody has to do the child care, right? And somebody has to manage the remote schooling. More than likely, they're going to choose, you know, the person whose job pays less, right? Or is seen as less demanding. And that has a lot to do with the fact that work in our society is very gender segregated. You know, men and women tend to dominate different sectors and different jobs, and those occupations that are considered to be feminine overall are paid less and tend to offer less upward mobility. We also know that there's a gender wage gap, which is even more significant for women of color than it is for white women who have been able to catch up some in recent years. And so, you know, women tend to be the lower earner in a couple. And then, of course, many jobs also don't offer much accommodation for parents of young children. Even when they do, there's a lot of research showing that when women take those kinds of accommodations, they find themselves on the mommy track. Often those accommodations are also not offered toward men. So this is, you know, one of the things that really results then in women in many heterosexual couples in particular, becoming kind of the fallback caregiver, the person who reduces their hours or, you know, leaves their job in order to manage the childcare. And we see this certainly, you know, these inequalities within the family are fairly well known, right? So before the pandemic, although there has been a lot of progress in, you know, men and heterosexual families doing much more childcare and housework than in the past, you know, it is still, if we, you know, look at, this is pretty recent data from 2019 showing, you know, mothers with children under 18 are doing a lot more housework and childcare than fathers. And then, of course, we also have had a childcare crisis in recent years, with the high cost of childcare also being a factor that has pushed many women out of the workforce. So all of these, I think, you know, were sort of troubling phenomena before the pandemic, and then the pandemic really magnifies all of these pre-existing inequalities. And, you know, certainly I think we could see a real long-term setback in women's careers and women's work, and particularly for women of color.
Very interesting. Thank you, Rachel. So Jack, let me go to you. There've been this is actually, I'm going to fold this in with a couple of questions people have been asking. And, you know, you mentioned how, you know, there's certain things that are learned in the home that translate into schools that allows children to navigate things in school. the question I think that's on a lot of people's minds, of course, is, we know about the problems with, when we've gone to online or remote learning, that, there's the stories of, you don't have access to the internet. I remember seeing an article yesterday, or a picture of people parking around a school bus in order to get internet, or outside, various restaurants, that sort of thing. But I've got a sort of a slightly different question, and that is, aside from the technical sorts of things, does going online, are the same problems that you saw earlier, do they manifest themselves? Another way of asking it is, some could, without thinking about it, go, well, doing it online might equalize all of this. But is there something that these populations are getting in the home that will actually allow them to navigate this new way of learning better, and maybe even accentuate those inequalities?
Okay, good question. First of all, you're right that, about 23% of American families lack the technology to do remote learning. In San Luis in southern Colorado, 60% of the kids in their school system don't have internet connectivity. And 43% of the families simply can't afford to be connected, even if it was available to these. Broadband access really has become an essential school supply, no different than paper and pencils and other kinds of things. And of course, these kids are anyone from a low socioeconomic situation is at a disadvantage. But speaking specifically to you, unfortunately, when we've gone to remote learning like this, often what we've done is we've carried over some of the worst teaching strategies that can be done. A talking head like I'm doing right now, and other kinds of things like that are very difficult for kids, particularly in these kinds of situations. The decontextualization, that is where the teacher has to have only minimal kinds of activities and materials that they can use because it's electronic. I myself find when I'm teaching my classes, sometimes the videos and things simply don't work. Well, whenever we're talking about content academically, one of the big differences between kids in the mainstream and kids who are from diverse backgrounds is that inability or less ability to handle decontextualized kinds of concepts and decontextualized kinds of tasks. But unfortunately, remote learning really does a lot of that kind of thing, a lot of decontextualized things. Some of these children, and it's because of cultural differences in socialization and other things and cultural values, don't self-regulate as well. And if there's anything that you really need to do in remote learning, you have to regulate yourself to be focused and to continue and to follow up on things. A lot of the parents of children from low socioeconomic levels, for instance, have physical jobs and they have to show up for their jobs. They can't do jobs remotely, and so they can't help monitor their children during the day when they're doing remote learning. So that's another problem. The independence that mainstream kids develop primarily before they come to school, and which is in the hidden curriculum, versus interdependence, which is a great ability that a lot of kids from different cultural and social backgrounds have, makes a difference. Independence really is geared towards remote learning kind of things. Interdependence is geared towards working in groups and discovering things together. That's also something that's eliminated in a lot of the remote teaching kinds of situations. And I think finally, the importance of close and personal interaction between teachers and students is one of the things my research has found is really important for helping kids bring along the skills and strategies they need to get those from sort of the hidden curriculum. And so I think that there are real problems with kids from BIPOC communities and from non-mainstream situations when we're dealing with remote learning. The Atlantic recently referred to in its November electronic issue the concept of pandemic schooling. And that's shown that socioeconomic status and diverse backgrounds may be the biggest detriment to schooling within the mainstream community while we're dealing with remote learning.
Yeah. Wow. Okay. Well, from that on to even tougher questions. Arturo, this one's from you. Basically, what I'm going to do for the audience is I'm going to go through the questions as they come in. So I'm just sort of reading from the top down, and then if I can find some ones that I can fold in, I'll do that. But this one comes from Helen Guron. I hope I'm pronouncing that right. This is for Dr. Aldama. Do you feel that the suggestions made by many scientists that people of color and older people get the vaccine first is historically reminiscent of the early biowarfare against indigenous peoples? Curious of your opinion. So clearly, there's a lot of distrust, right, about whatever comes out. And so in many respects, this is a question about whether or not that is going to manifest itself in different populations differently.
Right. Hey, Helen, thanks so much for tuning in. Helen was a PhD student here many, many years ago when I first got here, and has been teaching kind of indigenous history and culture in a whole variety of settings. And is just a brilliant writer. In fact, kind of her life story came out, and her brothers and so on, in the Enduring Legacies book that I published when I ended my directorship of the SARA Center for Race, Ethnicity, and Gender in the Americas. But great question, Helen. You're absolutely right. I mean, part of the biowarfare against indigenous people has been part of the strategies and policies of Manifest Destiny, and on, infecting indigenous peoples on purpose to, cause a full-on genocidal decimation of communities. We see other examples of the Tuskegee experiments and so on and so forth. They're just horrific, racist eugenics driving a lot of kind of medical practice in the Tuskegee experiments, using African-American folks, infecting them on purpose and watching how quickly just really, really horrible Nazi-like kinds of medical practice. So it's a really good question. And, it's going to be hopefully, as a vaccine is actually legitimate and becomes, widely available, I think there's going to be a lot of scrutiny on how it's actually deployed. And, I wonder if part of what you're getting at with your question is, are pharmaceutical companies and governments going to use BIPOC communities as a kind of a guinea pig to see if the vaccine works, right? And that's a really, really justifiable fear and concern. But then we have to balance that with, if someone's dying and, there's really severely at-risk communities. And so we shall see. Typically, in order for a vaccine to be approved, I'm not a health person, but what I've gathered is that, it has to go through a lot of rigorous kind of testing to determine whether, the efficacy rates and what the side effects are, and if the side effects are actually worse than the cure and the whole nine. And so with this rush to the vaccine, I don't know, but it's a really, really good question. And I think we should be really vigilant on how it's deployed. Best case scenario, just, it's a sunny day out, is the vaccine's actually serious and legit, and the folks who need it the most will hopefully get it first and hopefully get it free. That's just me being utopic. So.
All right. Jack, did you want to address that?
I just want to say that in the development of vaccines and other medical kinds of treatments, one of the things where BIPOC communities are really disadvantaged is that the clinical trials very often have very few people from diverse backgrounds. Now, the National Institute of Health is actually working to try to change that, but it's still a big problem, including a big problem with dealing with these vaccines.
Yeah. No, that's right. Well, let me again, I'm seeing a lot of great questions here, so I'm going to get to as many as I can. The ones we don't get to, I'll share with the panel, and we'll get back to you. This one comes from Mary Dolores, and it's general, so I'm going to open it up to to folks. It's in a sense, it's the used to be $64,000 question, is I'm dating myself. How can we tackle these inequities with local government policy? So what sorts of things do you see happening or not happening at the local government level that could actually help in the things that you're looking at? Any takers?
Yeah, I could start the comments. I'll start actually by talking about how local government is actually exacerbating the problem. So if you haven't paid it, there's a really powerful obituary that came out over the summer by Kristen Urquiza from Arizona. That was my first job out of grad school, so I still have ties there. And her father was this huge Trump supporter, working class Chicano man, cisgender man. And he followed the guidance of the governor of Arizona, who was following the kind of mandates of Trump. So he went out and, broke from all the social distancing, and he got COVID and he died quite quickly. And so, so some states are trying to be really proactive and take the pandemic seriously, and other states are being kind of hands off, but there's a lot of resistance. And so we can think of what's been going on in Michigan, right? The governor's been trying to really enact the safety protocols with the mask wearing, a 6 feet distance, and all of it. And the pushback on her has actually been extremely violent. These armed white supremacist militias and so on. So but other states seem to be doing a really really good job. But I don't know why it has become morphed into is this going to affect my my ability to get reelected? Is my stance on COVID, right? So how it's become politicized, something that is literally deadly, is just, well, your political science, David, maybe you have some thoughts on it, but it's just like so strange. It's almost like too strange to be true, but it's true, right? So, but, and I think also states would love to actually have real support from the federal government for accessing, PPP and all the different, things that communities need, right? And that's also been a huge issue, is that how do we even get into the supply chain demand and get all the stuff that we need for our state? And and so there's been a real disconnect between what FEMA and the federal government should be doing in the states. And some states have a lot of political will to actually be proactive with their communities, and other states are very much hands off, or very much like, oh, it's fine, go out, I respect your freedom, right? And then people die. So.
Yeah. All right. Well, so then this one, let me get to Rachel, because there's a question specifically for Rachel, and this is from Eliana Schechter. Could you speak more to how socioeconomic status has been a factor in women leaving the workforce during the pandemic?
Sure, yeah, and that has certainly been one of my questions as well. And I can share a few of the initial findings from the research that I've done this past summer, to speak a little bit about that. So this was just a very small pilot study, interviews with parents in the Boulder, Denver area, with children under 18 living at home, and asking questions about how the labor was being divided up in their household and who was doing what. Because it was a very short timeline study, it was a, what we call a convenient sample, basically kind of whoever I could recruit in a short period of time. So, the respondents were mostly middle-class professionals in the Denver, Boulder area, but I think it does give us a nice snapshot of how the pandemic has affected some of these educated professional families. And what I was seeing was that certainly, as with the things you've probably read about in the national media, right, that women did report doing the majority of the extra childcare and remote schooling, even when they themselves were trying to work full time. They expressed a lot of concern about the impact on their careers and their marriages. Men certainly felt burdened as well, but they, because of some of those dynamics that I talked about earlier, tended to be the higher earner in the family. And in many cases also had spouses who were not working or who were working part-time. So they were the ones who felt that they should be concentrating on work while their wife was managing the remote schooling. And this is a pattern that I found in a lot of these middle-class families, was that the husband's jobs really made a huge difference to how the sort of additional burdens of childcare and schooling were managed within the family. And when husbands had more flexible jobs, then they tended to be more involved in those things. But it was very common for many of these husbands who were, middle class educated men to have what are known as kind of greedy jobs, right? Jobs that seem to have rigid time demands. Now, of course, that may be a matter of perception, right? Whose job is actually more rigid in terms of its demands. But the way it was often seen in families that, his job was the one that was more rigid and often the one that was higher paying. So that job got prioritized. And so, the amount of labor in these households increased, but on the whole, the way that labor was divided didn't change a whole lot, right? That these patterns that had already been there before the pandemic were the ones sort of driving what happened during the pandemic. There were some families, about a quarter of the working mothers I interviewed reported a more equitable situation, which I think is interesting and perhaps speaks to some specific dynamics in the Denver and Boulder area, where women, and in these families, women either were breadwinners or men had jobs that were more flexible. I also interviewed a number of LGBTQ families, and they had often had sort of very specific discussions about labor in their household and how it would be divided in equitable ways. And that turned out to be an asset for them, I think, during the pandemic, and that they were able to manage things in ways that felt more equitable to both partners. So overall, I would say, I think certainly a lot more research needs to be done to really delve into the different sort of things that are happening in various socioeconomic groups and various ethnic and racial groups, to really understand the differences. I suspect that certainly when women are leaving the workforce voluntarily to manage childcare, it's either in situations where, the family has a relatively decent income, right? You have to be able to support the family on one income for that decision to be possible. So I suspect that's something that we would see in the middle and upper socioeconomic brackets. But for families that, don't have very high incomes, right? I think probably that's where we see women suffering more from layoffs, but most likely probably trying to continue working because both of those incomes are really necessary for the family. So I think I'm hoping to get more funding to continue and broaden this research. And I suspect those are some of the different socioeconomic dynamics that we would see.
Thank you, Rachel. Hopefully there's someone from the NSF in the audience that's so just be mindful, we've got about 7 minutes left, and then at 1 o'clock this meeting will self-destruct and we'll be turned off. But let me go to Jack here. This is a question that I think has really practical implications for a lot of people that are in the audience, actually, to be honest. Is that this comes from Christine Brennan, and the question is, how has the hidden curriculum changed in the new era of online learning for school-age children, and what specific immediate changes can teachers, special educators, and school personnel, I suppose, including administrators or including speech language pathologists, implement to address that so that BIPOC children are more likely to succeed?
Okay, thanks, Christine. I appreciate you even being here. It's a good question. And of course, as an interventionist myself, I'm really oriented to not just looking at what's going on and where the issues of the hidden curriculum, which is just an operational idea that allows us to take those sets of values and work with them, try to create some solutions. I think that there will be some changes if we continue to do remote kinds of teaching with kids. In the hidden curriculum, which is a dynamic kind of concept, merely saying the strategies and skills of one group, the mainstream middle class values, they create strategies and skills don't always get taken up or learned by children from other backgrounds simply because of the differences. I think, however, critical literacy, which is a very powerful technique for allowing children of all backgrounds, but particularly BIPOC children who are sort of not in that mainstream kind of conception, what it allows kids to do is to become much more oriented to agency and working to change things in their own context, in their own situation. And also it allows children to engage in reading and writing literacy in that sense, so that they can, in the words of Paulo Freire, read the world and figure out what it is that needs to be done to change the hidden curriculum and also to change their particular skills. I think another thing is that we simply have to engage in better kinds of mediations and interactions with children as teachers, as speech language pathologists, as parents, so that these kids acquire these kinds of skills. I'm not saying that there's a superiority to these skills that are in the hidden curriculum. One culture's differences will always sort of synergistically benefit everything else. The problem is our school systems in the United States, for the most part, are oriented to mainstream values, to middle class values, and those people who aren't in those middle class settings don't get it because it's implicit. We have to make things more implicit. It has to be done through mediation continually. And I think something like critical literacy is a great way to deal with it. People have been using it for 20 years.
Okay, excellent. All right, so Arturo, it's your job to bring us home here. I'm going to ask a question. I'm going to summarize it. This is from Jason Boardman. So in the interest of time, I'm going to summarize it. I hope I get it right. Jason, you can let me know if I don't. But it's an interesting question, and that it's political in nature, in the sense that, you know, you're talking about masculinity. Jason's asking about how much of the problem maybe isn't masculinity, or it is partly masculinity, but how much do you think is it this rugged individualism, right? Where, you know, I have my rights, this is how it's going to be. How much of that do you think is causing the problem? How do those two things interact, do you think? Or do they?
Yeah. Thanks, Jason, for that's a really, really great question. And then if folks are interested, I could share some of the URLs on chat, some of the stuff we've been reading to present all this. Yeah, it's a really, really great question. I mean, first of all, I want to just state that the whole notion of gender binaries, masculine and femininity, is really a kind of a Eurocentric idea that's been imposed on indigenous communities. And so most indigenous communities, you know, especially prior to colonization, didn't murder people for being trans or two-spirit. In fact, the whole language of, you know, a lot of native languages, even the word for boy, there's like 27 different words for boy. So there's been many indigenous nations or communities in this continent, and actually globally, Hawaii and so on and so forth, have a much more fluid, less rigid idea of you know, masculinity and femininity, right? And so, but in terms of rugged individualism, that very much is kind of the masculinity that, from our perspective in ethnic studies, ties into the kind of patriarchy of settler colonialism, settler colonialist violence, and manifest destiny. And so this whole, you know, me against the world and so on and so forth. And so, yeah, it's a really, really good question. But I think in Trump's case in particular, he's very much almost recirculating this kind of cowboy, hyper rugged, individualistic masculinity that, you know, he always wants to be seen as the winner. You know, everyone else is the loser, is the sucker, and, you know, all of these kinds of things, bullying and all of that kind of thing. And so there seems to be a real kind of resuscitation, if you will, of this kind of hyper-toxic cisgender patriarchal masculinity. You see all of this transphobic legislation, homophobic legislation, that, seems to draw a lot of his most fervent kind of followers. But again, masculinity in, different cultural contexts is a really different understanding of what is, the construction of this kind of Superman toxic, masculinity. So really, really good question, Jason.
So thank you, Arturo. That's, that was a great, a difficult answer to a difficult question, but a good one. There are a number of people pleading to get through the different questions. I'm afraid we're not going to be able to, but I do want to thank the audience for staying with us the entire time. And I look forward to having future webinars. I look for one in the middle of January. Send me at dsbrown@colorado.edu any ideas you have for a panel, and we'll try to work that in. But I want to thank Jack, I want to thank Rachel, I want to thank Arturo for a wonderful conversation. And I look forward to carrying this conversation further, and we'll get those questions to the panelists so they can start a conversation. So thank you to everyone. Thank you to the audience.
Thanks, everyone.
See you later.
Thanks, everyone.
Ciao.